Hello, welcome to Omnia Health Insights, your one-stop resource on all healthcare developments transforming the industry. Today we have with us Caren Busen from OBIX, and she is the Clinical Director. Welcome, Caren.
Thank you. It's good to be here. Thank you.
Thank you, Caren. So could you tell us a little bit more about yourself and your role? You've had 35 years of a prolific career, and in nursing, especially something that's so important at this point in healthcare. So if you could just tell us a little bit about that.
I'd love to. I started out as a labor and delivery staff nurse at a hospital in the United States in Quincy, Illinois. And I worked there for 35 years. And I went through the books, and I think I was probably involved in 10,000 births through my career there at the hospital. I enjoyed teaching childbirth classes, as well as helping with deliveries and participating on a lot of committees and things like that. And then, as in the 90s, when we started to move into the electronic world, we bought a product by OBIX, and that's how I got involved with that company. I started out as a clinical educator and then managed that group. And now I do clinical support for the international team here in the Middle East. And I've been doing that for the last 3 years.
So in your experience and in your wonderful career, what have you noticed are the common challenges that nursing professionals are facing, and what kind of methods are coming into place to, improve that?
Well, I think if you think about the majority of the nurses are female, are women. And we women are always balancing our work and our home life, and so you're always thinking about those things. And I remember through the years how we as nurses really tried to support each other so we could make it to that ball game or to that dance recital and things like that. And so a big challenge has always been we have to cover the hospital for 24 hours. So it's very challenging with different work shifts, and I think it's real helpful that many hospitals have gotten creative with some of the times so that maybe you can just work till 3 or come in at 3 and work till 7 and have those different shifts so that you can accommodate your home life as well, right? So erratic work environment is definitely one of our challenges. Another challenge is staffing shortages. It just seems like there's always an influx of people coming and going, and trying to meet the needs of the patients and make sure we have that patient safety in place. So helping with nurse status. So what can we do as leaders, nurse leaders, to promote retention, not just recruiting nurses, but then how do we keep them in our walls and make them the best that they can be. And I think another challenge is always negative patient outcome, and I think we've seen a lot of that in this last year and a half with the pandemic, for sure.
Absolutely, that's a very, I think what you touched upon was also time management and making that more efficient. So how important is support when it comes to ensuring that nurses are retained and they don't find other alternatives to have a more better career choice?
I think as nurse leaders we need to address the issues, some of the issues I mentioned, and there's others as well. And how do we keep those nurses engaged? Like, how do we get them involved and maybe help with the issues and allow them to help you with solutions to some of the challenges we have on the unit, instead of just, this is how it's going to be, do this, do that. Give them that opportunity to give us some input on what we can do better, especially after we've been through a crisis. The other thing I think we want to keep our nurses happy and engaged, and what kind of things can we do to support that? Like during Nurses Week, there's a lot of special celebrations throughout the year, and we can't forget to tell our staff nurses how great they are and what a great job they're doing, and educate them. The best thing for patient safety is to have a well-educated nurse at that bedside who can do critical thinking skills, and we need to give those nurses that opportunity to do that and support that resilience that we want to see in our nurses, not just with our nurses, but also with the whole healthcare. So those are some things that come to mind, right away. Definitely. And then within that, there's a lot of tasks and things we can do to make that happen.
Absolutely. Would you say there's some significant programs and practices that have come in place that have really elevated this?
Well, if I can I talk about the pandemic a little bit?
Absolutely.
So 2020 was to be the year of the nurse, and we as a company were real excited about that and how we can support nursing in 2020. And it sure was the year of the nurse, but not in the way we expected. So you had frontline workers that were working in areas they had never been before. We're trying to support patients. We were dealing with a pandemic that we weren't exactly sure what we were dealing with at first. We were losing staff. We were losing a lot of patients, and that it could be very stressful on nurses. We want to save and care for people, make them better, right?
Absolutely.
But in maternity and in general, some things that came about that were really positive, like we had to really reduce the amount of visitors that could come in. And so you can imagine if you had an ill baby in the NICU and only one parent could come in. And so using iPad technology and other things like that to help patients communicate or parents be able to see their baby were some real positive things that came through that they're going to continue to use afterwards. Because if your baby's in the unit, say for a month, and maybe the parents have to get back to work for a little bit of that, but wouldn't it be nice if you could remote in and actually see your baby or see a treatment that he or she's receiving, those kind of things. And then telemedicine, I think, really zoomed. And I think a lot of people kind of appreciate the ability to stay home and then talk to their doctor, you know, via telemedicine, and maybe not have to drive so far to get to the center just for a quick checkup. Obviously, there's things we have to be in person for.
How would telemedicine also affect nurses, and you know, because nursing is such a physical like in the hospital visit kind of process where, you know, they take your blood pressure and everything. So it's such an interesting way to see, you know, are we mapping out the plan for the future perhaps? Are there training practices in place?
I think for some of the future, what we need, and we have some, is like your remote satellite areas where you would actually have that nurse there doing the blood pressure, touching the patient, but maybe sending that information to the tertiary center, the doctor, and then saying, okay, the blood pressure was this, and here's some other parameters. And I think also there's a lot of technologies where that information can be done even by the patient and sent through the phone and sent to the doctor. So if I'm, say, at home on bed rest with some condition, I could keep monitoring myself. I may not understand the parameters, but if I could send them to my doctor and nurse, that would be, you know, really helpful. Maybe save some lives, because okay, you need to get to the hospital, or I think you can stay home for another week and you're good.
I mean, what an interesting time.
Yes, very interesting. And one thing I'd be remiss if I didn't touch on is the whole mental health.
Absolutely.
So during the pandemic, working long hours, stressful, losing patients, you know, the social distancing, wearing masks. Like you said, we're hands-on. We like to touch and see our face. And I think nurses have gotten real creative. Like they put their picture on their name badge, or over, you know, or get a mask with their face on it, so people, or a smile, so people could see that. But I think making sure that not only the staff nurses needed a lot of support during that time, and many hospitals set up opportunities for nurses to talk to a therapist, or, you know, to talk to somebody or have talk sessions. But also as nurse leaders, what about self-care? Because I know nurse leaders, you know, we were working hours, you know, many hours on end trying to, because the information changed daily, and we had to work through that and then support our staff through that, because they're the ones in the trenches, right? And I think being seen, go into that unit and work side by side with your staff and let them know that you're there to support them is very important.
Absolutely, and I cannot imagine about the challenges that might have arisen when you were in the trenches with, you know, nurses. So what would you say are the things that need to be touched upon in the future, especially when the pandemic is still, you know, sticking around for longer than we thought it would?
You know, we talk about electronic sharing of healthcare and information, and how can that be shared globally, if you will? Like, can't we combine all our forces so that we all come up with a vaccine, you know, quicker or safer? Or the other thing I hear, like in the GCC, is how that health information, how can that come across, and so that it's shared between the different healthcare systems? Like, if you go to one healthcare system, you're going to be able to get that, but if you move to another one, how does that hospital get that information so that you get the best care possible. And
Absolutely.
you know, we're all about patient safety, right? So I think those are some of the challenges of figuring out how to connect all these systems so that we need to protect that information. We don't want it to get out everywhere, but on the other hand, if I'm caring for somebody, I need that at my fingertips. So I think that's a challenge that we need keep working on our solutions for that.
Absolutely. Thank you so much, Caren. I think this was such an interesting talk which covered especially about nurses and how things can be improved for the future and how we can support the workforce in a better way.
I appreciate your time. Thank you very much.
Thank you very much.